I'm heartened in the fact that there have been people coming to get tested despite of the COVID pandemic. Usually we have some older numbers, but at recent times we have been having guys who are like 40 to 50 to 60 age groups, which we really appreciate. That's who we really want to target for this screening. There's like a mechanic can't understand what's going on with the brake unless it's going on the body. So Cancer Support Services considers screening very essential so we can control the possibilities of having prostate cancer. The pandemic has in some way inhibited some of our progress because we have to seek permission to get the men inside. And people always set up a very long line, so we're trying to be very accommodating in the context of the protocols which we have to do. I find that we have been concentrating so much on COVID, which, truth and fact, is important, but we have been neglecting other aspects of public health care, like NCDs, high blood pressure, diabetes, strokes. We have 274 persons dying of COVID from 2021, but if you really look at numbers associated with those who died from the other illnesses, there's a small percentage. So we need to refocus. Yes, but COVID as one essential things, but we cannot neglect the other things. I think that's the main thing we have to focus on. Comorbidities, I believe, is a very high risk for persons. I'm saying if we can control the comorbidities at some level, we can inhibit or reduce the levels of persons who actually die from COVID because their body is able to fight it better. If we concentrate only on COVID, then the morbidity rate will definitely go up, simply because we are neglecting the other things which give them more risk factors. So if we can focus in or try to control the comorbidities at a level where persons can actually fight off COVID, I think that's a better deal. But if we ignore it, then our death rate will continue to climb. As people are saying, people with comorbidities have a higher risk of dying simply because of comorbidities. So if we can control that, I believe that will help significantly.
Okay. And what are some of the things you think that we could do in the early, not only for persons who already contracted the illnesses, but persons who may be at the pre-diabetic stage?
Well, we have been telling people stay away, stay at home, social distance, don't go anywhere. But those persons who are staying home are actually persons who are afflicted by comorbidities, and that is bringing it out of control. Public education is one aspect we can do it, and people are having their regular visits to their doctor just for screening to ensure that they are still very controlled. Yes, we have a pandemic, but yes, we still have things that are outside the pandemic which can negatively affect us. So in my opinion, I believe that we should really concentrate on the comorbidities and strengthen those aspects, things we can reduce the death rate.